Eyali Lord Mayor w'ekibuga Kampala Erias Lukwogo Alamye baleeteddwa mu kkooti nga bayita ku Zoom. Ayogeddeko eri omulamuzi n'attottola nti ennaku ze ez'okufa zisembedde nti asigazaayo ennaku mbale okuva mu bulamu obw'ensi okusinziira ku basawo kye baamugamba endi abadde bamujjanjaba nti naye mwennyamivu nti agenda kufiira mu kkomera nga talina wadde obuyambi talina n'abantu be bamufaako nti kati omulamuzi oyo amwozesa alinga amutadde ku kalabba ak'okufiira mu kkomera naye ng'afa ebirwadde ebadde birina okujjanjabibwa e India. Akabizza abantu amaziga mu kooti ng'annyonnyola attottola ebirwadde bye ebimumazeeko ebbanga eddene n'engeri gye bibadde bijjanjabwamu bulijjo kati nga takyafuna bujjanjabi era kuba nti abasawo baamugamba nti kaaliva ku bujjanjabi obwo wajja kuyitawo ennaku mbale 1 2 3 4 afa ave mu bulamu obw'ensi kati agamba ennaku ze ziweddeyo essaawa yonna afa era akoze ekiraamo mu kkooti. Ka tulabe ebigambo bino Erias Lukwogo.
Yes, Honorable.
Yes, Your Worship.
Please address court on the health concerns that your counsel just informed the court.
Thank you, Your Worship. I'm in possession of a medical report from Mulago Hospital here, made by senior consultants, 5 senior consultants. These consultants include the senior consultant on orthopedics and spine surgeon, with the team leader Norbert Ogoth.
I beg your pardon, senior consultant of
orthopedic and the spine surgeon, Dr. Norbert Ogoth. I have senior consultant physician cardiologist Michael Mugoma, I have a neurologist, senior consultant physician Stephen Matovu. I have also a consultant neurosurgeon Joel Chiyawiri, and associate consultant orthopedic and spine surgeon Dr. Edward Chionde. These are senior medical consultants who were tasked by the executive director Mulago Hospital, Dr. Rosemary Yanima, to examine my state of health. I spent a whole week in Mulago undergoing specialized investigation and some interventions that could be made within the capacity of Mulago Hospital. Your Worship, it's a detailed report which is on record of report, because I can see court received it on 1st July. It's addressed to the Chief Magistrate. It's dated 30th June 2026. There is a forwarding letter written by Dr. Byanyima K. Rosemary, the Executive Director. Your Worship, after thorough examination, they established that I suffer 5 chronic health challenges. 5 chronic health challenges. which are very, very serious. And as we speak today, my life is in danger if they are not attended to. I have a problem with breathing. They mentioned it here. I have a lung complex with what they call residual mild cylindrical bronchitis. Which is a permanent damage on my lungs. And once I'm in a place with limited oxygen, I suffer breathlessness, and that's why here I was gasping for air, because the windows had been closed and I was not breathing well. And they recommended that I should always be in a well-ventilated environment because of that pulmonary challenge. It's called my current pulmonary functional tests, which they conducted, indicated that I need that kind of environment. The second one is that I have a residue cervical radiculitis following a cervical 6-7 disc replacement surgery and the adjacent level C5-6 disc disease. That is the cervical problem I am enduring ever since I underwent a surgical operation on 29th of April 2024, which I have been nursing all through. And these senior consultants have strongly recommended, and I want to read the verbatim, their recommendation after that finding, that Lukwogo should have a spinal review by his primary spine surgeons in India to re-evaluate him for the persistent upper limbs radiculitis. It's a medical term. That they were unable to repeat the MRI investigations because they were not certain of the compatibility of the implants, the artificial disc that were used for his primary spine surgery and MRI scans. So the point here is, when they conducted an anterior cervical dissectomy with the disc replacement at C6 here, the nerve root at the spinal cord, there was an implant, an artificial disc, which was inserted here. And when I went to Mulago, after conducting the investigation, they did a CT scan, they discovered there were attendant issues which had complicated this situation and required further examination and urgent attention by the neurologists and neurosurgeons who conducted the surgery in India, and that is immediate. It's urgent. So I was put on some kind of therapeutic treatment. They gave me pregabalin, at least to contain the excruciating pain I am undergoing, I am facing. That excruciating pain is being mitigated by the use of some medication, part of which is pregabalin. And of course some scrubs like Fofastum and others. That is the second one, Your Worship.
That is noted.
The third one, Your Worship. Yes?
I said that is noted.
I was saying that one requires immediate evacuation to India, and I should be in India by now. I need to be in India now. If my life is to be saved. Whereas I've been condemned to death. And there is a limit, Your Worship, to using of these neurotherapeutic whatever medicines like pregabalin. I interchange with the gabapentin. Your Worship, I was also diagnosed with the persistent anomasia and tinnitus, which occasioned eustachian tube dysfunction, ETD, as well as Meniere's disease and olfactory dysfunction. Your Worship, the ENT commended that they made a finding, if you could listen to this. Lukwago's ENT conditions are irreversible and he should be maintained on his current medication. That this condition I am suffering, complicating my hearing system, my eustachian tube, is irreversible. The only medication that I have, Your Worship, is twofold. One, I can keep using sedatives to be able to sleep. Initially, I was using clonazepam. In Malago, they had given me clonazepam. Here in Irusira, they had given me diazepam. But prior to coming here, I was using bromazepam. So imagine from clonazepam to diazepam, now to bromazepam. And the doctors will tell you they are very, very addictive and dangerous to one's life. They can't be used sustainably or permanently. So prior to my being arrested and incarcerated here, the doctors had recommended that I use a tinnitus pillow. And that tinnitus pillow, Your Worship, helps to mitigate those sensations in the ear, like muffled sounds and all that which complicates the hearing system, the whole system, including eustachian tube dysfunction. That tinnitus pillow, if you were to look at it, it has got specifications that are made. I had to undergo tests to establish which kind of pillow I needed, the gadget I needed. So after the measurements, they sent those specifications to UK, where it was ordered and brought within 3 months. I had to endure that problem for 3 months. When it was finally brought, it alleviated the problem because it's the pillow that I use. It has some gadgets, it's wired, It has got a remote, it has got some loudspeakers, and there are different sounds it plays depending on your health complication, Your Worship. So, unfortunately, ever since I was arrested, it's now 3 weeks, I've not used it. And I'm on sleeping pills. So when we went to Mulago, Dr. Biso Fred, who is the NT consultant on the team, made the recommendation, and it's the report here. The entire consultant, all the consultants said, please allow this, unfortunately, the prisons authorities, because they feared for security reasons that it has some gadgets inside, tore it and removed some parts, so it got dismantled. Up to now, I am not using it. It was brought here, but it's dysfunctional because it had been dismantled. I've been struggling with the prisons authorities to see that my relatives reach out to the experts who worked on it to see if it can be repaired, but it's a tug of war. Have not been successful, Your Worship. So up to now, the tinnitus pillow is not with me. It's in the office of the OCCI, Office of Prisons. I don't have it, and I cannot use it because it's dysfunctional. So I'm spending sleepless nights unless I use sedatives. I've reached a point, Your Worship, where these sedatives can no longer work. Even when I take them, I've been placed on the doors. I can only sit for 1-2 hours. Then I sit till morning. Over the weekend, when I got some stronger one from out, the doctors had advised I shouldn't use it unless they guide me for good reason. Unfortunately, Your Worship, I couldn't afford, I couldn't wait. I started on it, but they have cautioned me the dangers of continuing with those sedatives under the circumstances. The third one, that is the third one, Your Worship. The fourth one, Your Worship, because these are all chronic, is gastritis. And here, this is their finding, Your Worship. They made a finding Lukwogo has got non-erosive GERD, GERD, gastroesophageal reflux disease, and erophagia, which causes belching and mild hiatus hernia. Your Worship, if I may explain to you, hiatus hernia is some complication in the gut here, around the sphincter muscles here, the diaphragm here. You get the stomach bulging towards the gut, so that whatever contents you have in the stomach, which are highly acidic, they spill over back to the gut, causing what they call acid reflux, regurgitation, and in the end, they may cause lower esophageal cancer. There's what they call lower esophageal sphincter. It is now that lower esophageal sphincter is now flabby. So I have to lie almost, if I'm to sleep, the head, I'm not supposed to sleep flat. I am supposed to lean upwards like this, to just keep the contents down so that there's no overflow of acid and food from the stomach back to the gut. It is so scorching and is likely to cause cancer of the esophagus if not attended to. So this hiatus hernia requires surgical operation. They have to operate it and remove that part which is protruding, that part of the stomach that is protruding into the gut, so that you can have the food content contained within the stomach. This is a very serious problem, Your Worship. For now, they recommended specialized diet, which can help me manage, but I can't afford it. I cannot have it here. You know the conditions under which I'm contained. Unless I am admitted, I'm given that special diet, it's not possible. So what I'm now doing is to constantly use what they call PPIs, proton pump inhibitors, to contain the production of acid, and also all sorts of types of antacids, like suspensions, like syrups and chewables, and all those sorts of antacids, so that I can keep controlling the acid reflux and acid production. But that is a temporary measure. Even diet is a temporary measure. The lifestyle change is a temporary measure. All I need is to have a surgery so that they deal with that hiatus hernia that is posing a serious danger of having gut cancer. So finally, the final one, Your Worship, they made a finding that, and this is actually, it's not a finding, Lukwogo should continue with his current treatment for hypertension. No doubt I'm a known case of hypertension. For the last 10 years, I've been on medication. And this problem gets worse with all these complications, the cocktail of these health challenges. In the end, they complicate the issue of hypertension. So now it may be now relatively contained because of the suppressive mechanisms we are using to deal with these other complications. And the cardiologists have also advised, if I continue with this sleeping posture to contain the issue of GERD, gastroesophageal reflux disease, or gastritis, then it affects blood saturation. I will have again to raise my legs up so that as I sleep, so that blood flows, to ease blood saturation. Now you can imagine, I have all these problems with the gastroenterologists who are part of this team are advising me to have this particular sleeping posture with the head leaning up. The neurosurgeons are advising me to sleep on an orthopedic mattress which is hard and lie a little flat, not raising myself. Cardiologists, Mr. Mungoma and others, are advising me to raise the legs up. Then, meanwhile, the pulmonologist, that is Professor Rodri and the team, they are advising me to keep in a well-ventilated place. Yet, you know the conditions of the prisons. The prisons are not well-ventilated. So, in a nutshell, Your Worship, I am sentenced to death. I am condemned to death. If no rescue is made to get my situation addressed, as advised by the consultants from Lago, it's a death sentence for me. And all I can say to Allah, if you are to take me, my Lord, the God who created me, kindly take me without a lot of pain. If I may make a last prayer, Your Worship, instead of taking me through all this pain, I be put on some palliative care so that I die a less painful death. Otherwise, the pain is too much. I know I will die. I know all of us will die, but I wouldn't want to die a painful death. I beg to pray.
Mukama. Owulira nga amaanyi gakuweddemu. Owulira nga amaanyi gakuweddemu. Nga ne byolowooza bikuweddeko. N'ogaana naye ddala ensi eno tutwala wa? Ddala tuli ku ki? Lwaki omuntu yandibadde ayisibwa mweno embeera? Nebyo beeyita abakulembeze baffe. Batwagaza balaga kutwala nga tufudde. Wabbo ye DNA yaabwe yakutta akutemula. Tumusabire omuli Erias Lukwogo.